Hi, and welcome back. Today we're going to talk about assessment, but not in the heavy formal testing way that you'll dive into in your other courses. This is about something more human, how we practice assessment skills in counseling conversations, how we gather information while also building connection, trust, and a foundation for the work ahead. If you've taken psychology courses before, a lot of these ideas might already feel familiar. That's okay. What I encourage you to listen for today is how counseling techniques, things like your posture, your tone, your silence, are not just background noise in assessment. They actually shape the entire assessment process. So we're not just filling out forms or collecting information, we're starting relationships. I want you to think about this. Assessment is your first real opportunity to practice counseling. It's not just paperwork, it's not just getting through a checklist. The moment your client sits down and you start asking questions, you're already setting the tone for everything that comes next. The real goal of assessment isn't just to collect the facts, it's to start building trust. You're helping somebody feel safe enough to share real parts of themselves with you. And that doesn't happen by accident. It happens by the way you invite, the way you listen, and the way you make space. At the same time, you're also working to understand the client's problems from their point of view, not your assumptions, not what a textbook says about their symptoms. You're learning how they make sense of what they're going through. And quietly, you're also beginning to form a roadmap for counseling. Where are we starting? What direction does this person want to move in? You won't have all the answers after one conversation, you're not supposed to, but you're starting to get a sense of the terrain. Now, a huge part of doing this well comes down to your invitational skills, the things that we just talked about from chapter 4, how you sit, how you make eye contact, the kinds of questions that you choose. These small things make a big difference. They either open the door for a client to trust you or they shut it. So, when we talk about assessment today, I want you to remember you're not just gathering information, you're practicing how to be a person that your client can actually talk to. And before we move on, I just want to take a moment and pause and think about what makes you feel safe to open up to somebody. If you can identify two, three, four things that make you feel safe, it's possible your client might feel the same too. Are there ways that you can incorporate that into the counseling relationship? So let's talk about the two core methods that we use during assessment: observation and questioning. First, observation doesn't mean that you sit there analyzing your client like a science experiment. It means that you stay awake and present to what's happening between the words. You're noticing things like affected mood, what emotional tone is coming across, thought process, are their thoughts logical, scattered, stuck? And especially nonverbal communication, speech patterns, eye contact, grooming, posture, how they move in the room. These details tell you things that your clients might not have words for yet. Sometimes they tell you things that your client doesn't even realize about themselves. Technique wise, this is where attentive silence becomes powerful. Just being quiet, letting space hang for a moment, often gives you access to way more than if you rushed in with the next question. And your own body language matters too. An open, relaxed posture, leaning in slightly, soft eye contact, it tells the client that it's okay to show up here, it's okay to take time. Now, moving on to questioning. This is where you actively invite the client's story, but how you invite matters. Use open ended questions that leave the door wide open, not a yes no trap, not a checklist, but real invitations like, can you tell me more about what's bringing you in today? What do you hope might feel different after coming in here? Notice the tone in these examples. It's neutral and warm, not pressured or leading, and it's definitely not an interrogation. You're not trying to corner them into giving the right answers. You're helping them start to tell the story in a way that feels safe. If you remember nothing else about questioning at this stage, just remember this. Good assessment questions open up the room, not shut it down. When it comes time to actually conduct an intake interview, I want you to think in broad strokes, not a giant checklist. You're trying to get a feel for a few key areas. First, the affective domain. How are emotions showing up in the client's story? Are they describing sadness, anger, fear? Are emotions they're experiencing matching the emotions that they're describing? Sometimes emotions leak out even when somebody is trying hard to stay controlled. Then there's the behavioral domain. What's happening day to day? Are they getting out of bed, going to work, using substances, sleeping too much or not at all? Behavior gives you clues about how they're coping or not coping with their situation. Next, the cognitive domain. How are they making sense of the world around them? Are there distortions in their thinking, like catastrophic thinking, black and white thinking, hopelessness? Or maybe you hear resilience and problem solving abilities starting to poke through. And woven into all of this, you're also listening for developmental history, how they grew up, family history, what dynamics shaped them, cultural context, what values, traditions, and experiences are important to them, and physical health factors like any medical issues that might be affecting mental health or vice versa. You're not trying to cover everything in one sitting. You're building a foundation that will keep deepening over time. And technique wise, there are two things you absolutely want to practice here. First, normalize sensitive questions. When you get to a harder topic like trauma history, substance use, suicidal thoughts, be upfront and kind about it. You might say something like, "These are questions I ask everyone because they help me understand how best to support you." It helps take the sting out of it. It signals to the client, you're not being singled out, you're not in trouble. I'm here to understand, not to judge. Second, attentive silence matters even more during the hard parts. After you ask something sensitive, don't rush in to fill the space. Let them think, let them feel. That quiet is often where the real answers start to surface. So, after you've gathered all this information, the emotions, the behaviors, the thinking patterns, the history, the next challenge is figuring out what to do with it. Assessment isn't just about collecting details, it's about organizing what you're hearing into a story that makes sense for you and for the client. Think about it like qualitative research, if that makes sense for you. It's just got one participant. So, let's talk about how to make sense of all of that information without getting overwhelmed. When you finish your first intake, it's really normal to feel flooded, like you're holding onto 1,000 puzzle pieces, but you have no picture on the box to guide you yet. You might be thinking, where do I even start? That feeling is part of the process. It doesn't mean you're doing it wrong. One of the best things that you can do early on is let go of trying to remember every single detail. Instead, start listening for themes. Ask yourself, what keeps coming up again and again? Where is the client feeling stuck? And where does the client show even small sparks of hope or energy? Themes will help you make sense of the story without getting buried under the names, dates, or every minor event. You're not aiming for perfection here. You are aiming for an organized sense of where the client is and where they might want to go. Now, eventually, in later courses, you'll learn how to use all of this information to put together a formal diagnosis, but that's not our focus today. Today, we're focusing on the earlier skill, how to use what you're hearing to begin shaping goals, helping clients move from describing their struggles to imagining what positive change might actually look like. And that's the next step that we're heading into. Now, once you've gathered enough from your assessment, the next step is moving towards action, and that starts with setting goals. Why does goal setting matter so much? Because goals give counseling a direction, they give the client hope, and they make the work feel purposeful instead of just talking in circles. And they guide you as the counselor so that you know what you're aiming for and how to track progress. But not just any goal will do. The best goals are simple and not overcomplicated, specific and clear enough that you can tell if you're moving toward it, positively framed, focused on what the client wants to grow, not just what they want to get rid of. It's got to be important to the client, not just what sounds good to you, and realistic or achievable given where the client is right now. Technique wise, there are two powerful types of questions that you can use to help set goals. The miracle question. So, if therapy works, what would your life look like then? It invites the client to dream, to imagine a life beyond the problem. And then there's the specificity question. What's one small thing that would tell you that things are getting better? This helps put the dream down into something real, something that we can work towards session by session. So I want you to just stop and pause and think about a time that you were struggling with something big or small. What helped you feel hopeful enough to start making changes? So we want that experience to guide how you approach goal setting with your clients. And once you have a few solid goals in place, you've got a foundation to work from. Blur isn't just about setting goals, it's about how you show up in those first conversations, how you build space for assessment to even happen. So let's wrap up by bringing it all back into your role for assessment and why these early counseling skills matter more than any form that you'll ever fill out. As we close today, I want you to hold on to this. Assessment isn't just about gathering information, it's about practicing warmth, curiosity, and patience under pressure. It's about being steady when somebody is nervous or guarded and doesn't know yet if they trust you. The forms you fill out, the questionnaires, the checklists, those things do matter. We do need data for diagnosis and goal setting, but the real assessment happens in the space that you create with the client. The way that you attend to them, the way that you ask questions that actually invite them to speak, the way that you pace yourself, giving them time when they need it, and holding the thread of conversation when they lose it. These early counseling skills are just as important, honestly, often more important than any diagnostic tool that you'll ever be trained to use. Assessment isn't a pause before therapy starts, it is therapy. The beginning of healing, one small moment at a time. So, as we're wrapping up, I want to leave you with a couple questions to think about. What's one assessment technique that you already feel pretty comfortable with? Maybe it's something small like your ability to sit with silence or how you naturally pick up on a client's body language. Or maybe you already know a ton of assessment tools that you can use. And then I want you to think about one skill that you want to practice more intentionally moving forward. Maybe it's slowing down your questions or getting more comfortable with asking about tough topics without rushing. So take a minute to answer those for yourself. These early skills are where you're going to start shaping the kind of counselor that you're going to become. Thanks for being here today. I'll see you next time as we keep building these foundations together.